right, let's get started with this next session. Just to give you a little bit of, a couple things. Again, on your desk are these blue cards. These blue cards have the activities for the Weber County Medical Society through December. You know, for part of my career, the first 5 years I was with Intermountain Healthcare. The next 8 years I was on my own, me and Dr. Allen, Dave Allen. And a lot of that time I felt very disconnected from the rest of medicine, right? I am a strong believer that the more we are engaged with other people in the house of medicine, the happier we'll be. You know, these Weber County activities are awesome. I think getting us together is a powerful thing that we can do. If you look at where it says September on here and it says House of Delegates, Salt Lake, that is the Utah Medical Association House of Delegates. In my other role, I am on the UMA board of directors. Excuse me, I'm one of the board members. And ever since residency, I've been involved in the UMA and especially the House of Delegates. If you want to see like change happen, if you want something that you think needs to change in medicine, something you think needs to change in Utah, being involved with the House of Delegates is the way to do it. And I'm sure you guys will talk about this. The way that works is you have each county and each specialty and each clinic have delegates that go to the House of Delegates, and anyone can bring a resolution, say this is something I want to have changed, and if it ends up passing, everyone comes together for that Friday, Saturday, they discuss that resolution, they discuss that idea, and usually they are able to craft something out of that actually makes sense, and then that ends up being Michelle's marching orders. And for me, like, when I feel like there's so much of medicine that I have no control over, right? I don't have control over regulatory burden. I don't have control over insurance. I know that I can actually go to the House of Delegates and be involved with the UMA and actually make a change and move that needle to actually make my life and life of my patients better. So if you want to be involved, if you want to see, okay, what can I do 2 years of, take 2 days of my year and make a difference, that is how you do it. So Michelle, I'm sure, will talk a little bit about that. We also have President Dr. Curtis Peterson that's going to speak to us too. He is currently our president of the UMA, and he is awesome. I've really enjoyed these last couple of years of working with him and being on the board with him and learning great things from him. He's a no-nonsense kind of guy and doesn't take no for an answer, and sometimes he says, you know what, this is just how it is, and I appreciate that viewpoint. So who's going first? Kurt? All right.
Well, it's good to be with you, colleagues. This is the first time I've been to Weber State ever. I've never come up north this far. I've gone up to Logan to watch some football games, but I haven't come here. But I have my roots in Ogden. As a matter of fact, I was born in Ogden when my folks lived here. My mother had 2 boys before me and was told that she should not have any more children because of her complications with pregnancy. And she said, I need to have one more child. And so she found this OB guy in town in Ogden who was considered to be, according to my mother, the high-risk OB, and his name was Lindsay Curtis. And he said, I'll get you one more child, but then you're done. She said, fair enough. So obviously, he and my mother were successful, depending on how you define success. And I am here, but that wasn't the end of the story. I heard many, many times from my mother that the reason I'm here is because of Dr. Lindsay Curtis. As a matter of fact, your middle name is Curtis, and you are named after him, and you will be a doctor. Once again, that has come to fruition for whatever it's worth, and I'm sure my mom is happy about that. A little bit more about me. I didn't stay here. We went to California. I grew up in Southern Cal and Central Cal. Served a mission for my church, the Church of Jesus Christ of Latter-day Saints, and I only bring that up because I was sent to Texas Spanish speaking. One of the best things that ever happened to me. You can't imagine how much Spanish you really need to have if you want to be a good physician in the state of Utah. It makes a world of difference. So if you're thinking about learning a language, learn Spanish. I then attended BYU, and the only thing about BYU and my claim to fame there is that for the last 4 or 5 years, I've been to every BYU football game here in a way there has, except for 2, to watch my nephew, Tyler Batty, a defensive end and an edge, play football, and watched him sign a contract to work just a few months ago as a football player with the Minnesota Vikings. So I no longer bleed blue, I now bleed purple. And so hopefully I'll be able to go see some of those games. From that point, I went to medical school at the University of Utah, and then went into a residency in anesthesia, shifting over from internal medicine. And after that, did a fellowship in pediatric cardiac anesthesia at Sick Children's in Toronto, Canada, which was a great event for me and a great opportunity. Since that time, I have worked only at Primary Children's Hospital. It's pediatric anesthesia. And I have just recently retired. And of late, I've retired like just last July, because a year before that in July, I started to have a little weakness in my hand, and as things went along, had a cervical fusion to get my weakness to go away, and my weakness didn't go away. And as you saw me getting helped up through these stairs here, the cervical fusion was a swing and a miss. Oh, by the way, you have ALS. So I'm kind of fighting that battle with a great taskmaster who doesn't give up. And I'm not going to give up either. Never give up. I used to always say that. And I had to quit practice. Oh, thanks. I had to quit practicing because, well, I had to give up. And that's the reality of the situation. But you saw me limp up here. And now, just to put this into perspective, it's not a limp, it's a swagger. Okay? So, and I've had the opportunity to work with the Utah Medical Association for many, many years. With the State Society of Anesthesia, the American Society of Anesthesia, and like Adam, on boards, and worked with the Utah Medical Association, and it's been a real opportunity and an eye-opener for me, and I've learned a lot of wonderful things. One of the things that we're going to talk, well, Michelle's going to tell you the meat of this whole thing, and I will be very brief, is about the Utah Legislature and what we do. Now, just an aside before I get into that is, Michelle McOmber is amazing. She is like a workaholic. I don't know how she keeps going and why she hasn't dropped dead before this. Or maybe had someone kill her. I don't know. She can be a little polarizing. When you work at the state legislature with those guys, that's just how it is. And she has been wonderful. I've known her for the 20 years she's been with the Utah Medical Association. And one thing that I can say with complete confidence, as I've known the other CEOs of the Utah Medical Association before her, that there was no one who is more attuned to and about Utah physicians and would do more for Utah physicians than Michelle McOmber. And we are so fortunate to have her in the state. You need to realize that whether or not you're a member of the Utah Medical Association, if you are a physician, the Utah Medical Association and Michelle McOmber speak for you. And to go along with Adam's plea, if you want us to speak the way you want us to speak, then you need to get involved in the Utah Medical Association. You need to go to the Day of the Doctors. You need to be a delegate in the House. One voice, I'm telling you, can make a huge difference in how medicine is practiced in the state of Utah and how we are treated. And with that in mind, I would just like to read to you, and then I'll finish up, the mission statement, which is very short for the Utah Medical Association. Utahns will receive excellent public and individual health care services. Of course, that's what we want. That's a given. UMA physicians will practice ethically in a collegial environment without undue regulatory and administrative restrictions. I believe that medicine should stay out of the practice of politics and legislature, and that politicians and legislatures should definitely stay out of the practice of medicine. That is not the world that we live in. And so we have to get involved, or the saying is very, very real. If you're not at the table, you will be on the menu. So we need to be involved in what's going on, and Michelle's going to let you know. And this takes up pretty much most of her effort and time and heartache and headache and probably chest pain when she meets with the legislature when we have, thank heavens it's a short session, only a month and a half or so, that we go through that. It goes on for the whole year as bills are brought up and resolutions are made in the House, and we try to formulate ideas and keep a pulse on, which Michelle does, on what's going on the Hill. But it's very, very important that we stay involved, okay, and that we have people there who can be the bulldogs that we need to promote those mission statements that we have in the Utah Medical Association. The Utah Medical Association exists for physicians. That's why it exists. And I believe that if physicians are treated well, that is the best thing we can do for our patients, regardless of anything else. Okay, if you have the ability to practice medicine according to the way you think it should be practiced and it's good medicine, that is the very best thing we can do for the people in the state of Utah. The other part of this mission statement is that UMA physicians will receive appropriate remuneration for their services. Now, we all want that. You know, we all want to be treated fairly. We also want to be paid fairly. And I firmly believe that every physician should be paid according to the market forces rate that is out there and not be regulated or legislated in any way, shape, or form. You know, we need to stand up for ourselves, be fair with each other and with our patients and with those with whom we work, hospitals, insurance companies, but we need to be treated fairly. And I think we should demand that we be treated fairly in the coming future, or again, someone will tell you how much you're worth. And I think the more that we are free to work the way we want to work and feel like we're being fairly treated for what we're doing, I really believe that is the best thing we can do for our patients in the state of Utah. So again, I would encourage you to support the Utah Medical Association, support your county association, and I applaud you for being here to improve the quality of health care that you deliver to your patients by furthering your education and your ability to treat those patients in a great way. Having said that, let me just conclude by saying it's great to be back home in Ogden, and thank you for your time and your efforts, and it's going to be great to hear from Michelle. Thank you.
Thank you very much. I enjoy coming up and presenting to you and listening to some of the questions and things that you have on your mind. I was a little concerned with seeing that I came after Glockenflecken, because how am I gonna beat that? Legislation is pretty boring, pretty dry, not very funny. I do have a joke, though, that I'm gonna start with maybe. A pollster called up a voter to talk to that voter about a candidate, and the voter started to really go off on the candidate and said, you know, a lot against the candidate, and then ended with, I'm either going to kill myself if this candidate is elected, or I will move out of the country. And then the pollster paused for a minute and said, okay, I will put you down as uncertain. So legislation is either like watching paint dry. That is a lot of what we do up there, is we wait and try to figure out what's going on and listen to different, or it is like making sausage, which is an ugly process, and I know you've heard this before, but you don't want to watch it being made sometimes. I'm going to go quickly through these slides so you have some time to ask questions at the end, and I apologize in advance for having a lot on slides because in the interest of time, I may not tell you everything that's in the piece of legislation, but I wanted you to be able to read it if I don't go over every single point of that legislation. Just to begin, because you have to know what the political climate is like in Utah to understand our legislature and the votes that they take. Our legislature, as Kurt mentioned, is a 45-day session, 45 business days every year. However, They do meet annually in interim meetings, so every month, and more than once sometimes. They will meet for different committee meetings, and in those committee meetings, if they pass if they have a vote on a bill during that interim meeting, it will go right to the floor and not have any other committee meetings at the beginning of the session the next year. So it is actually a full-time job to watch what the legislature is doing and participate in the legislature. There in the Utah House, there are 59 Republicans, 16 Democrats, so a total of 75. There are 38 votes needed to pass a bill out of the House. In the Senate, there are 22 Republicans, 6 Democrats, and 1 forward party. Now, that was an interesting thing that happened this year. One of the senators, towards the very end of the session, resigned from the Republican Party and then went with the forward party. So you have a total of 29 senators, and you need 15 to pass a bill in the Senate. So a bill goes to the House, goes to the Senate, and then you need a governor, to also vote for it, not veto it, for the bill to go through. Or a bill can start in the Senate, but still in the reverse order, and it still needs to have the same number of votes. So we are a supermajority Republican legislature, so keep that in mind as we kind of go through some of the issues that come up in the legislature. I'm going to talk first about a bill that the trial attorneys brought forward. So these are plaintiffs' attorneys that wanted to really overturn the medical malpractice that we have worked very hard over the years to put in place. So they introduced House Bill 288, and they asked Representative Abbott Nelson to run it. Now, he is a trial attorney. He does not do med mal, but he does sue people in his day job. So statute of limitations are the amount of time that you can take before something runs out and you're not able to move it forward in law. So the bill that was introduced would have doubled the statute of limitations, and there are a number of statute of limitations in the medical malpractice law. The first would be to commence a lawsuit. And this isn't just, by the way, for physicians. This is for all healthcare providers and hospitals. So keep that in mind. We're fighting against this bill on behalf of all providers. So this one would have doubled the statute of limitations to commence a lawsuit from 2 years to 4 years, to change the discovery from 4 years to 8 years. Think about that. Think about 8 years. Now, I know it's different for OBs and even pediatricians because they have a longer time, but for most providers, it is 2 to 4 years to commence. Changes the discovery from 4 years to 8 years after an injury, act, omission, neglect, or occurrence. And then from 1 year to 2 years if a foreign object was left in the body. The other thing that the trial attorneys wanted to do was we have a non-economic damages cap that we managed to put into our statute about 10 years ago. And that non-economic damages cap, so this is money that is paid to a patient if they've had some kind of, not even necessarily an injury, but an occurrence, and they've taken it to court, and they are giving this for pain and suffering. So this is kind of an arbitrary decision. They also have economic damages that they can collect. So just keep in mind, this is the pain and suffering side only. So they wanted to raise it from $450,000 to $950,000, more than doubling the non-economic damages cap. And then to also add a medical inflationary annual adjustment. So we fought hard against this bill. Did not think it was appropriate, didn't think it was necessary. It really just harmed the providers, and we already have a hard time keeping people in the medical field, treating patients. And so we fought against this one, and the bill was defeated. Thank you. On the flip side, we had a physician from one of our large clinics in Utah approach the president of the Senate about some things that he was concerned about in his clinic and with medical malpractice. We've had just about every medical malpractice reform that you can in the state of Utah, but There are some things that obviously we can always improve. And by the way, this is one of the issues that really rallies everybody together. I don't know of any doctors that are actually against this unless they happen to be an attorney also. Then it could be a little bit. But this rallies everybody together, which every bill does not. We have as many differences in opinion throughout the providers, the physicians, all in the state of Utah as we do throughout the state. So just keep that in mind. But medical malpractice rallies everybody. So what we ended up with putting in this bill is the Supreme Court last year, we had already put an affidavit of merit requirement into the statute that said that if you went through the pre-lit panel and it was found to be non-meritorious, you need an affidavit of merit in order to move forward with bringing a lawsuit. The Supreme Court said, nope, that is barrier to access to courts. And so they overturned that piece of the statute. So we decided, well, let's look at this again. How can we get affidavit of merit kind of back in there? Affidavit of merit is a specialist of some sort in the same field saying, yeah, there is something to this. There was some act or omission or something that was done that could really say to you, let's move forward with the lawsuit. Although we know that expert witnesses can be hired, so you can get one for each side. But we wanted to put affidavit of merit back in because we thought that was an important piece of the statute. So what we did is we changed it so that if somebody has a claim brought against him, goes through the pre-lit panel again, it's found to be non-meritorious, then you still have to get an affidavit of merit to go forward. You don't have to, but if you get an affidavit of merit to go forward and it goes through the court case and it's still found to be non-meritorious, then you can't have your defense attorney ask for reimbursement on costs for your attorney. If they go through the pre-lit panel, it's found to be non-meritorious, they don't get an affidavit of merit, it goes forward to a court case, the court finds that it's non-meritorious, then the defense side can be awarded attorney's fees in that situation. So we got the affidavit of merit back in there, but it does not prohibit going forward with a lawsuit. The other thing that this particular bill did, it did two very important things. Well, most attorneys, most trial attorneys, we're seeing higher and higher judgments in court cases, in medical malpractice claims in court cases. And so the one thing is that oftentimes the plaintiff's attorneys, even though in statute it does say they can go after personal assets, but they will threaten a provider, a physician, another provider, to say, if you don't settle and we get a high judgment, we're going to go after your personal assets. And that was in statute that they could do that. So, of course, that's a great incentive for somebody to settle. Whether or not they did something, it was just an occurrence, something happened, it doesn't matter. That's a great incentive for a provider to say, okay, no, I want to settle. Even when their attorneys, their defense attorneys say, well, they're really not going to. But then, well, can they? Yes, they can. So we got in statute that they could not go after personal assets at all as long as two things were met. Had to have $1 million in medical malpractice insurance. Okay, at least $1 million. Well, that's the standard, so. And then a provider's conduct, if the provider's conduct is willful or malicious or intentionally fraudulent, if they intentionally harmed the patient, which, you know, that's not going to be the case for 99.99999% of the cases. So they cannot go after your personal assets if you are named in a lawsuit. The other thing that it did is oftentimes when they present, if you've ever been in a medical malpractice case, if you've ever had one brought against you and you're in court, is the plaintiff's attorneys would often introduce economic damages, you know, to try to get the economic damages pushed up. They would come in with billed charges. Now think about that. Do any of you, for health care that you are giving for a patient, whether they've been injured or not, get billed charges? And the answer is no. You get what is either actually paid or owed. So the amount on your insurance statement, your EOB that the patient gets, that is not how much they're actually charged. So we put in there that has to be what is actually owed or paid. And then, again, we were able to, through a lot of effort and a lot of lobbying, get this through. Oh, thank you. I'm going to talk for a minute about, mind you, there are about 200 bills a year that deal with healthcare, with practice, with patient care, with anything that has to do with healthcare. Obviously, I can't put them all in my slide, so I've chosen a few to go over. Last year, we passed a bill that limited the amount of nicotine in e-cigarettes to 40 milligrams per milliliter, or 4% nicotine by weight. And we also limited flavors of e-cigarettes. So this year, 1 year later, not even a full year later, introduced by a legislator, is on behalf of the e-cigarette sellers and those who are manufacturing and what have you, introduced a bill to reverse all of that. So it would have added all flavors back in. It would have taken out any limitation on nicotine content. So we fought hard on this one too, and were able to defeat the bill. Thank you. Maternal and fetal infant amendments. This one actually ended up being a combination of two bills that were introduced. And the reason that happened is because bills were, at the very end of session, were stalling and there wasn't enough time to get them through. So they combined two bills into this bill. But the bill that was originally introduced, you all know about the infant automatic blood testing when a baby is born, right? Anybody not know about that? Testing for rare diseases, that's the heel prick. This bill would have said that the only way that that would happen is if you gave the patient, the woman, a consent form 24 hours in advance of having the baby. Now think about that. 24 hours in advance of having the baby, and got their consent to do the infant heel stick. Well, that would reverse 100 years of building up these diseases that they test for, which of course can be very, very expensive over time and can actually, kids can die from some of the diseases that they get, can be very, they can be disabled, or they could, in many instances, receive treatment and live a normal life. So we fought to have this left alone, to say we're still going to go ahead and do the infant heel prick, is still going to test for the rare diseases. And on the back side of that, though, the Department of Health keeps the sample for a certain amount of time to do the testing, and then also, in some instances, to do testing or to use that sample for particularly the hearing test that might need to happen years later. So the only thing that this bill actually got through on that side of things was to say that that there did need to be a consent to keep the biological sample by the Department of Health after 90 days, just in case. But again, we were able to, make sure that this test continues to happen for infants. The Department of Health, the second bill that was combined with this was House Bill 326 that requires the Department of Corrections and county jails to test for pregnancy upon admission, so up to a woman up to 50 years old, and then collect parental information on inmates and report data on pregnant inmates and children. And that's in an attempt to help provide services to get these people the help that they need so that hopefully they wouldn't reoffend, to bring families back together. So that was also thrown into this bill at the last minute. We were supportive of that. And that one passed. I'm going to turn to mental health for a minute. House Bill 276 was a bill that we pushed and we asked to be introduced. We were looking to try to decrease the amount of time between when a patient is put on hold and when they have a commitment hearing. So sometimes it can take up to 11 days, and that's a long time for a patient to be sitting in a hospital not having an evaluation and a commitment hearing. So in an effort to at least make one step towards decreasing the time, we wanted to put in there that either an exam or a court appearance could be done through telehealth or telecourt proceedings. And if it is in the best interest of the patient, still obviously, and if it isn't, just as fast to do it in person. So hopefully to just kind of speed up the time a little bit. Another thing that happens is that when a patient is on hold, once the commitment process or proceedings have started, you couldn't then have two examiners come together and say, no, never mind, we don't need this person to go through a commitment hearing. We actually can treat them and get them out. This bill puts that into statute. There are a bunch of other things that were part of this bill, some definitions on intellectual disability and some standardizing of different things, allowing providers to start medicating a patient. Those weren't in statute before, but they are now, so this bill passed. That's one that I didn't go over all of them, but hopefully you were reading the screen as I was talking. So mental health continued. This one by Representative Stephanie Grecius. If you have children that are in school, this affects you and your children that are in school also. It requires mental health counselors to obtain informed parental consent before providing restricted services, meaning mental health services, in school. And that consent includes the name of the student, the authorized mental health provider, the statement that the provider will provide information about the service to the parent, and the parent can opt out of receiving that information. The provider will adhere to topics the parent identifies, unless the provider feels, the provider who's giving the care, feels omission would compromise the student's immediate safety or violate mandatory reporting obligations. And then prior consent is not necessary if a delay it will create immediate serious risk of suicide or serious bodily harm to themselves or others. We put some amendments to this bill to make it better like that. Originally, it just said you're going to have to consent for everything that the healthcare provider talks to the student about. And so concerns that we had is what if the parent was abusing the child or things like that. So some of these amendments were put in at request. So this bill passed. Senate Bill 48, Behavioral Health Amendments by Senator McKell. This allows mental health therapists to treat emotional disorders. This bill was actually targeted at life coaches. There are a broad range of life coaches out there, and the legislature is fine with that. They were figuring out whether they should license them. They're not licensed in the state of Utah right now. But the biggest concern was, and they do a broad range of things. Some of them get into behavioral health, mental health issues, and most of them don't. Maybe it's, how to plan your time, how to do whatever. So the legislature kind of said, well, the big issue that we hear from other providers, mental health providers, that includes physicians and nurse practitioners and others, is that, who are in the space, psychologists, that these life coaches are doing mental health or behavioral health without having training. And so this bill actually is targeted at those life coaches that are doing mental health therapy or behavioral health therapy. And so in the way that it was written and the amendments that were put in it, we supported this bill and it did pass. Freestanding emergency centers. I don't know if you guys heard about this huge fight between nurses and physicians on the same side in the hospitals, and it had to do with the freestanding emergency centers that are in the state of Utah. We don't have a ton, we do have some. So this bill started last year. There were provisions that went back and forth, screaming matches between hospitals and some of the physicians. The person who ran it, Representative Katie Hall, is actually married to an orthopedic surgeon, and she herself is a nurse. She works in these freestanding centers. And so it was very important to her too. But we worked through, in the end, this bill was a consensus bill, and I'm not going to go over all of it. But it does put in some more safety requirements. Okay, it puts in some safety requirements in these freestanding EDs. If they're going to be called an emergency department, then they should have some of these safety requirements in place. It bumps up staff a little bit. It tells who's going to be, that it's a board certified or eligible emergency medicine physician. This is in counties of the first and second class, by the way, not in a rural area. So this is Wasatch Friends, St. George, Logan. It requires 2 registered nurses on staff who have specialized training in emergency and are trained in some of the other things that they've been required to do. Clinical laboratory tests and analysis and x-rays and CT scans, some of these things that were not happening. They may have been happening in some of the freestanding EDs, but not all of them. So in the end, again, this was a consensus bill. It's a bill that we supported, and the Hospital Association in the end actually supported it too, even though it started out as a very contentious bill. Psilocybin and MDMA. When this bill first came out, it was very, very concerning to us because basically what it said was that palliative care providers, and it didn't define who those were, by the way. So it was wide open as to what a palliative care provider was. And then psychiatrists can access illegal, because it's not legal federally, on the black market, grow their own, whatever, magic mushrooms, which is psilocybin, of course, and MDMA, which is a street drug. It's not that we're not seeing some benefits and research showing that this can be helpful in certain mental health circumstances. But it is also with intensive psychotherapy. And University of Utah, Intermountain, they are doing studies in this area. FDA is also. And we are seeing some good uses for it, but it needs to be appropriately purchased or sourced. It needs to be able to be dosed. And there's a lot of things that were concerning to us in this bill. So we, with the help, brought some help, physicians who were working both in palliative care research and in on the psychiatry side of things in to help us. Talked to the senator on this, and we were able to say, no, we'll work with you into the future. We do think there's a way, but it isn't this way to go forward, to just open up the doors to illegal substances. That will cause more problems and more harm. So this bill was actually withdrawn by the senator after working with him. Advanced healthcare directives. There was a big rewrite of Living Will's Advanced Healthcare Directive law this year. We worked with Senator Comer on this, and Medical Association has actually created new forms based on what's in the bill. So we wanted to make sure that this was a good deal for providers, for physicians and other providers who both help with their patients getting a living will and then also in the care of a patient that has a living will and needs a surrogate to help them to make decisions. So it revises both physical and mental health living wills. It defines capacity, what mental health care directive is and regular health care directive is. It establishes default surrogates. So it is very specific about what the surrogate is going to be and who it's going to be and how it's going to work in the order that I've listed. Spouse, then adult child or parent are equal in being a surrogate. Then next, the individual's cohabitant. Then next, adult sibling. Next, adult grandchildren or grandparent, equal. An adult not already listed who has assisted the individual with supported decision-making for 6 months or more. Now, that's a little bit harder, but, in the end, we were okay with that because they may not have any of the others who could be surrogates. An adult stepchild, and then an adult who has exhibited special concern or care or concern. And then, in the end, a physician. Patients wanted that. They said, I have a physician who's treating me but is not treating me, who may be my primary care physician but is not the physician who is helping me because I've got a, cancer. So they can name a physician, but in those orders. And if one surrogate is not available, or say there's 10 children and 5 say, I want you to do this, and 5 say, I want you to do this, and there's an equal, instead of the physician or the healthcare provider having to say, hey, we're going to make this decision, it actually says, in that case, there's a tie, you move on to the next surrogate. And it is not the provider or the physician who has to call and find out who the next surrogate is. It is the surrogates who can't agree. They say, okay, this is the next one down. So moves on down the line. The other part, the Advanced Healthcare Directive, things that it does, it once a healthcare professional becomes aware of lack of capacity, you have to make reasonable efforts to determine if the individual has a surrogate and then, if possible, before the healthcare decision, communicate the decision to the patient and who the surrogate is that's making the decisions on behalf of the patient or surrogates. And then document it in your chart. And then you can, as a healthcare professional, refuse to provide healthcare because it's one, contrary to policy of the healthcare institution that's providing the care, or the care would require healthcare that's not available to the professional or the institution, or 3, require the professional to provide care that is contrary to generally accepted healthcare standards, and the provider just says, no, I'm not going to do it because it's not standard care. It does provide immunity for healthcare professionals or institutions acting in good faith under this statute, so not subject to civil or criminal liability or discipline for unprofessional conduct. Vaccines, we've had vaccines bills every single year. This year we had HB 84, and this one was a little bit unusual, but if you're on social media, if you're seen any media whatsoever, you've probably heard about this. So, you know, there's this big push that there's talk about adding vaccines to food. And so Representative Lee was like, well, I want to preempt that and say we're not going to allow that in the state of Utah. It's going to be treated as a vaccine, as a drug, and therefore go through the drug process and not just be able to be added into food. So there's some talk about adding to lettuce and other things. So in this bill, it says food intended for human consumption that intentionally contains a vaccine or vaccine material is considered a drug for the purpose, and the vaccine is defined as prepared from a causative agent of a disease, the disease's products, or a synthetic substitute treated to act as an antigen without including the disease and approval by the FDA. So that passed. We don't have any of that happening right now, but it is a proactive piece of legislation. With the way that that was worded, we were okay with it. We didn't fight against this one, and it did pass. HB 228, right now in the state of Utah, and you know we have low immunization rates for our children here in Utah. So you do have any number of ways to opt out of immunizations for children as they go to school. But the one thing that we did have in our statute was that if you were going to opt out, every time the child changed to school, you needed to, have another form that you filled out. Kind of it was a way to make somebody think again, do I really want to do this? Am I going to, maybe I've changed my mind. Maybe I should, let my children be vaccinated. But this bill by Representative Lisenby, who's very far right and runs things like this, she ran a bill, and it was widely accepted and supported in the legislature to say once you filled out a form, that's it. Then anytime you move to a new school, so if you go from grade school to middle school, high school, or move to another school, period, the form will follow you with your school records. So be aware of that. Miscellaneous health bills. You probably all heard about, and you've seen in social media, and we all know RFK Jr. and all the rest of it who are fighting against fluoride. And so in Utah, we had 2 counties who had voted, by the way, to put fluoride in the water, not a ton, but fluoride in the water. Salt Lake County and Davis County had fluoride in the water. Utah County had actually voted to put fluoride in the water. They never ended up doing it. So the state, in a preemptive move, ran legislation, Stephanie Gracious, to say that no counties, don't care if your county wants it, can put fluoride in the water. And it does, because of that, they're saying, well, let's give some other option, some other way for people, particularly low-income people, to get fluoride. And so they're saying now that pharmacists can prescribe fluoride, and that was their answer to some of the pushback on that. We were concerned because it increases cavities, et cetera, when you don't have fluoride. So we did work with both. We worked with the public health folks. We worked with the dental association. Didn't matter. This bill passed. HB 133, I want to mention there are a ton of gun bills every year. A ton of gun bills. And Representative Lisenby, who I mentioned before on the vaccine bill, runs at least one gun bill every year, but we have a ton of gun bills. Most of them are loosening up gun laws. A few of them, usually from the Democratic side of things, are trying to put some restrictions in, like gun safety, gun safes, etc. Representative Liz and B ran a bill, and this is the only one I have ever seen of hers that failed. But we all pushed back against this one, because this one was saying that anybody 18 years and older than that can carry a gun or a shotgun, a loaded gun or shotgun, in your car without one having a concealed carry permit or any kind of thing like that. So there were a lot of us working together on this one, thinking this is where our docs, this is where our other healthcare providers see injuries, a lot of injuries. And so this one for the first time failed. Other miscellaneous health bills. We had some statute that was put into language about, I want to say, maybe 5 years ago, that talked about, in a notice after a mammography that had to go out for people who had dense breast tissue, right? And this, it was specific as to what the language could be. Senator Karen Maine ran this one. It was a big deal to her because she'd had some cancer. And so we ended up saying, okay, fine, put the notice in. It really isn't, it's not necessary. It isn't really anything that's helpful. But this language this year, again, by Representative Hall, a nurse who is married to a doctor, ran a bill to repeal this language. So no longer will this language have to go out when somebody goes in for a mammography. And this language had said that if you have dense breast tissue, it's commonly found in more than half of women. It's hard to accurately evaluate and detect early signs of possible cancer, etc. But really, from all of our physicians, this is not a necessary statement to put in a mammogram, and so we were supportive of getting rid of this language, and this bill also passed. Medication in schools, another House Bill 333. So we had a number of medication in schools bills. This one allows a student to possess and self-administer epinephrine rescue medications, nasal spray at school under certain circumstances. They have to have a prescription, etc. But this one we were supportive of, and it did pass. And then raw milk amendments. This one, this last year, and this is just the ones that we know about, there were approximately 15 children who were admitted in a hospital because of an outbreak from getting infected from raw milk. And so this one puts some regulations in if people are going to sell raw milk. It doesn't prohibit it, but it does say, hey, let's make it a little bit safer. And that's what some of the provisions that were put in. So regulating the third-party labs and epidemiological investigations and specific testing procedures. And then also cease and desist orders, how those work, and then after a foodborne illness outbreak. So that was a good bill too, and that one passed. I know I went through that very fast. I didn't know if I would get through all my slides for the timing, but I'm going to run this short video, and probably you guys have seen it before, and I didn't create it. But it is how I feel during the legislative session and in dealing with legislators and others. Again, it's not my video, but
this man right here is my great-grandfather. He's the first cat herder in our family.
Herding cats. Don't let anybody tell you it's easy.
Anybody can herd cattle. Holding together 10,000 half-wild short hairs, well, that's another thing altogether.
Being a cat herder is probably about the toughest thing I think I've ever done.
I got this one this morning, right here, and if you look at his face, it's just ripped to shreds, You see the movies, you hear the stories, it's
I'm living a dream.
That's how I feel during legislative session. Sometimes I feel like I'm herding cats. I am happy to, there are two other bills I want to mention real quick, and then we'll get to questions. There was a comment earlier about AI. So there was an AI bill last year, and I mentioned it to you when I was here last year, that requires anybody who has a professional license and is using AI as part of what they do to disclose that to a patient. So if you're using an AI script or whatever else, you have to disclose that. But there was a bill this year, an AI bill, House Bill 432, that was specific to mental health chatbots. So in a mental health chatbot, you cannot share users' identifiable information unless it is from provider to provider. And you cannot, suppliers have to inform users that the chatbot is AI, not a human, and that they comply with privacy and security regulations. So we're going to see a lot more bills on AI coming forward because of the technology that is advancing. But be aware of that. We are one of the states that has put in some of the first regulation on AI. Not all states are quite as forward-thinking on things as that. So we, from our standpoint of how is it helpful to providers without hurting patients and without being the one to diagnose, et cetera, how do we move forward with that? How do we move forward with AI? And then the last one that I wanted to mention was healthcare, again, because prior authorization was mentioned. There was one prior authorization bill this year, Senate Bill 274 by Senator John Johnson. This bill requires insurers to report prior authorization, pre-authorization data annually to the Department of Insurance. We supported this one, starting in 2026, and including the approval rates, denial rates, reasons for denial, submission methods for both, urgent and non-urgent requests, etc., and then report back to the legislature. And we thought it was important to support this effort and this bill because insurance companies say, oh, we don't do it that much, doesn't happen often, and, they get the care that they need. And so this is a data collection bill this year. Once data is showing, we've run some prior authorization bills before, but we only get so far with the insurance companies pushing back. Once we get data, it's going to be much easier to then go to the legislature, because we say one thing, the other side says something else. To go to the legislature and say, okay, here's the data. They require prior authorization this many times, and yet it's needed care, and yet then maybe down the road, they say, the care can happen, or they give a prior authorization and then later on take it back. So this is an important step forward for looking at prior authorization, and hopefully that's something we can deal with in the future. So I have about 10 minutes. Happy to answer any questions that you might have. As you can see, the healthcare bills that we deal with affect all healthcare providers. And so even the work that we're doing for physicians oftentimes is a benefit to other healthcare providers who provide care to patients. Any questions? I'm glad to see I didn't put you all to sleep after having lunch and having Dr. Flannery. He told me he was going to put in a plug for my, my presentation, by the way, and then afterwards he told me, I'm sorry, I forgot.
Michelle, excellent job. Thanks again for the representation. We really do appreciate it. Any update on Dr. Ray Ward's bill on marijuana that I personally, professionally disagreed with, which is essentially expanding the use of marijuana and removing some of the regulatory guideposts? Just in my own personal clinic, I continue to see patient after patient who is hospitalized inpatient 4 weeks, now on 2 psychotropic medications, having a very hard time entering back into the workforce. The American Psychiatric Association strongly cautions using marijuana for any psychiatric condition because of the adverse effects that we're seeing, and his bill seemed to expand pretty widely the use.
Yeah. There is an update. I took the medical marijuana bills out of my presentation because I noticed there was a medical marijuana presentation here. So I took that information out, but his bill would have done away with, there's a requirement to have 4 hours of training for before you start being a recommending provider, and then there were different levels of recommending providers. One was a limited, one was a full-fledged recommending provider. As a limited provider, you could have done 15 without getting the education, without having to move forward into a recommending provider. He took out those distinctions and just made it a recommending medical provider. We fought and got kept in place the education requirements, but it is education that is similar to what you have to get now when you get your continuing medical education hours. And so you just attest that you took those 4 hours. And so it was really pretty prescriptive before. Now that prescription is taken out. There were a lot of other little things. There is some limitations on advertising in that bill, which Representative Daley Provost's bill, which failed, would have expanded pharmacies from 7 in the state to 47, one of the two numbers, can't remember right now, and done some other things, loosening up all of the advertising. Ray Ward's bill actually did tighten up and make sure that the advertising is not just left open for producers and wholesalers and everybody to just advertise out there. So it's very prescriptive as to what can be advertised.
That's great.
Yeah.
Thank you, Michelle.
You bet.
So I practice in Davis County, and we've always had fluoride in the water. I figure we'll just adjust and give fluoride supplements. But I heard something a couple days ago about on a federal level, maybe trying to restrict fluoride supplements, whether that be over the counter or prescription. Do you know much about that? And would that be a federal thing, or would that come to the states to decide on fluoride supplements that we're going to be doing now?
Okay, so let me mention something, the juxtaposition between federal and state law, okay? Federal law, if the feds come out with a law that is more restrictive than a state, federal law will trump any state law that you have. Okay, if a state comes out with more restrictive, they can definitely do that, but they can't be more permissive than a federal law if it addresses the same issue. There's all sorts of, proposals. There's a proposal right now that probably is going to happen. So Medicaid, we spend $8.4 billion in the state of Utah on Medicaid services. Some of that is brought down from a federal match by provider taxes, a hospital tax and then a nursing home tax. Bring some of the money back into the state to provide those services. But on the federal level, they are right now saying they're not going to allow any more provider taxes, and they're going to reduce the rate of provider taxes that you're allowed to do in a state. And so that's going to, affect our funding for Medicaid on our state. So that's going to be a big issue coming up. And then with, of course, RFK, with some of the, some of his beliefs and being over what he's over, it's going to, we're still waiting to see some of those things that are happening. But there is, yes, some sentiment by the federal government, some of them, again, to do things with fluoride. Yeah. But the federal government isn't actually nearly as effective in terms of passing a bill as our states are, because there is so much contention between the two parties. Any other questions? Okay, I think I kept it to my time, Adam, so.
So when is the date of House of Delegates?
September 12th and 13th.
Okay, so September 12th and 13th. If you are available those days, I can't recommend enough. I would love to have a lot of people from Weber County there. And the thing is that when all the Weber County spots get filled up, Paige with the UMA can find a spot in your specialty or your organization or whatever. So if you are interested, I would love to have you there. If you need help, if you have any questions, I would be happy to answer any of those questions. But like I said, I can't overstate enough. A couple years ago, one of the other organizations wanted to push through a resolution, and so they tried to get as many of the people they could from their society there, and they kind of changed things that were different than how a lot of people in the state of Utah want things changed. So there is power in showing up and making changes. So if you're interested, if you're willing, please reach out to me. Or Paige with the UMA, can find a spot for you. But I would love to have you there from Weber County. I think we're stronger when we show up together. Okay, thanks, guys.